So yeah, I was watching the game last night.
Oh gosh, is these Filaria people again?
Hello everyone,
Hello.
I'm with the Ministry of Health, here to distribute our annual Filaria tablets.
So wait, like if every year y'all share these tablets?
Why so often?
That's a very good question. Filaria is spread in mosquitoes, and the worm could live inside you for many years. Taking the tablet once is not enough to stop them. That's why the program provides them every year to break the cycle of transmission.
So how come people still get Bigfoot and body after taking this pill?
Yeah.
The Bigfoot and the Gori is not caused by the tablets. It's the disease itself. See, Filaria, it actually damages the lymphatic system over time, which causes scrotal swelling and Bigfoot. The pills actually prevent that by stopping the worms before they cause permanent damage.
Oh.
So it's really about all of us.
Not just one person?
Exactly. By each person taking their dose, we move closer to eliminating Filaria from Guyana.
Alright, well, we'll take ours today.
Yeah, I think that's the right thing to do. We'll take ours.
Remember, everyone in your household needs to take the tablet too. That's how we protect families and our whole community.
We are talking about Filaria gonna get knocked out. TKO.
We have persons that take the pill, and if you ever get Filaria, let me let you know now that you're not going to get according to your height. President method, what we give you is a triple drug therapy. Ivermectin, dexamethasone. Spread the message. Encourage your colleagues, encourage your peers, encourage your parents, encourage the stranger on the street. Tell them what you know about Filaria.
Triple drug therapy will knock Filaria out in 2 rounds. They get the job done, best to show respect. Respect, yeah. Idea is what we are talking about. Filaria gonna get knocked out. TKO. We gonna end Filaria. Prevention is the only cure. Take your pills and be secure. Ivermectin, and albendazole. The triple drug therapy will knock Filaria out in 2 rounds. They get the job done, best to show respect. Respect, yeah. Idea is what we are talking about. Filaria gonna get knocked out. Go spread the word in your area. We gonna end Filaria. Prevention is the only cure. Take your pills and be secure. Ivermectin, and albendazole. The triple drug therapy will knock Filaria out in 2 rounds. They get the job done, best to show respect. Respect, yeah.
Welcome to the program, Dr. Sampson.
Thank you for having me, Ms. Martin.
So the Ministry of Health has recently launched the Filaria Mass Drug Administration Campaign 25. And I know that we are seeing a lot of people in purple within Regions 3 and Region 4. But before we get into the campaign, could you tell us about lymphatic filariasis and why it is a public health concern here in Guyana?
Most definitely. Contrary to what people believe, because when you're on the ground and you're interacting with persons in the community, you hear a lot of myths concerning what lymphatic filaria is. So you would hear things such as, oh, it is caused when, if you walk barefoot on cold concrete, or if a frog blew on your foot. And also, people tend to believe that it's somebody working obeah on you, hence that's the way you get swelling to your limbs and so on. But lymphatic filariasis is a vector-borne disease, vector in the sense that it is caused by a mosquito. So it's a mosquito-borne disease that is spread the disease when an infected mosquito bites a human. So it's transmitted from human to human through the bite of an infected Culex mosquito. So that's exactly how an individual or persons within a community can be affected by filaria.
Wow, what is the objective of this year's campaign?
Excellent question. So, as you know, we would have been doing MDA for a very long time here in Guyana, and we are on our way to being one of those countries where it is no longer a public health issue. We would have already eliminated at a regional level in 8 of our 10 administrative regions.
Awesome.
And when I say eliminate, it means that when we did our survey, it showed that less than 1% of those populations we find persons who are actively transmitting the disease. So for the 2 regions that we currently have doing MDA, it is because we find in certain communities within these regions, namely in Region 3, Parfait Harmony, Region 4, Lodge and All Boys Town, when we did our survey back in 2021, it showed that persons were actively transmitting lymphatic filaria. This means that when we took a blood sample from them, we actually saw the filaria parasite or worm in their bloodstream. Hence, this is a concern because as long as they're actively transmitting, they're putting their family, the community, and even those regions that I would have already eliminated at risk. Hence, the objective is to ensure that these communities in these regions also fall below that threshold of where less than 1% of the population is actively transmitting the disease.
Dr. Sampson, for this campaign, what can persons expect within the communities? We know that we are definitely supposed to look out for persons in purple, but when those persons approach them, what can they expect?
So you can expect well-trained individuals because all of our pill distributors, national supervisors, and field officers, they were trained to do what they're set out to do. So when you see them come to your schools or even to your household, your workplaces, of course they're going to introduce themselves. As you mentioned, they'll be clothed or they'll be wearing the Ministry of Health PAHU branded t-shirts. So it's either purple for the pill distributors and the supervisors, you'll see them in the blue t-shirts. So when they come to you, they're going to introduce themselves, explain why they're there. And of course, if you have any questions for them concerning the campaign and the pills before you take it, you can feel free to ask them. They're capable to answer those questions and ensure that you're taking the pills from an informed after making an informed decision, you take those pills, and they will, of course, measure you because we're using a height-based dosing schedule. So they'll measure you, and that will determine how many pills you take. And, of course, important to note, we expect or we encourage that you take the pills in front of our pill distributors. That's the only way they can, ensure that they're documenting correctly that the pills were taken and not thrown away or put aside or any such thing.
Are there any side effects from these pills?
So with any medication, you can expect some side effects. But let me first say the filaria pills that we're distributing are safe and effective. I took mine when we launched, and I'm perfectly fine, as you can see right now. I had no issue even immediately after taking the pills. For some persons, of course, the side effects it's subjective. It depends on the individual. They may experience mild drowsiness, headache, and even a bit of upset stomach, but this does not prolong for beyond 24 hours. If it's to happen, it's just for a few minutes and that person is okay again.
What medications are being distributed under this campaign, and how are they, or how will they help in preventing the spread of LF?
Good. So we have 3 different types of anti-parasitic medication or dewormer, so to speak. It's a triple drug therapy, hence it's ivermectin, diethylcarbamazine or DEC, or some people know it as Banacide, and we have the albendazole. So the purpose for them being used together is that they have different functions, so to speak, in targeting the parasite within the individual. For example, your ivermectin will kill those microfilaria or the baby worms. Your DEC has effect, or they will also kill your adult worms, while the albendazole have effect on killing both of them, but not to the extent as the individual ivermectin and DEC. Hence, they're given as a combined drug regimen.
Thank you, Dr. Sampson. We'll be right back with more on the Filaria campaign 2025.
Go spread the word in your area. We gonna end filaria.
I just took my pills to prevent filaria. I encourage all of you to take yours as well so that you can stay safe and healthy.
Drug therapy will knock filaria out in 2 rounds. They get the job done, better show respect.
Filaria worms can live in your body for years.
Mom, what's filaria?
Listen, it's an infection from worm that spreads through mosquito bites. And if we don't take the pills, we can get really sick.
And it's not just about us. If one of us has it, then mosquitoes can spread it to the whole neighborhood.
That's so scary. What should we do?
Simple. We take the pills together when the health worker comes around, And that way, we're safe.
Right. Healthy family, healthy community, no excuses.
What we are talking about, Filaria gonna get knocked out, TKO.
In our bedroom.
Yeah, blood.
I said like you didn't pass it through today.
Nah, boys, them Filaria pill people stop me and they take come to me on help.
Oh, but hey, I hiding from them people all now, boy. You want none of them things. Plus, I skipped them people last year. And did you and I feel good? Make no sense I take that. You think the sister gonna take us out? Yeah.
No matter what, you could feel good, but the worm still and you said you could get your big foot and all.
Oh, hey, Bigfoot, worm. Hey, man, stop playing, you know. Hey, me auntie take them pills and she gets sick. We need. Plus, me auntie, me sister and them did I take it. That them Bigfoot and them things come from crap who blowing on your foot. Yes. Or over your body, and no Filaria your body.
Nice, serious body. You see, if you don't take the pill, the worm goes inside you for years. Plus, when the mosquito bite you, you can pass some crime, give it to your family or even weak. Aside, plus, your auntie must have had the thing and all, the pill help shit. Don't believe in them over be a stubbornness, dog.
So wait, you telling the rascal get this thing you could give family and don't even know?
Yeah, man. Plus, if the thing get bad, your foot and your skin will up big. Even your baskets will big, you get gory.
Hey, you are none of that. Hey, bye, best you take this pill and done, bye. Yeah, but this why we all got to take the Filaria pill. Yeah. Protect your family and everybody else.
We are talking about Filaria gonna get knocked out, TKO.
I'm a lover of dancing from since a small I danced the foxtrot. I was sitting home watching TV, and while I was watching TV, I felt a pain in the foot. So I went to the hospital, and then they find out that I was having the filaria.
Lymphatic filariasis can be a chronic disease, and left long enough without being treated or identified can cause debilitation. If you're infected as a child, it's there, it multiplies in your system, in your body for years until it actually causes damage to the lymphatic system, and then you have the sequelae, you know, the elephantitis, the hydrocele, and so on.
I was a qualified referee of Guyana, and I had to do a lot of heavy training. So it left in me that I learned to dance, and I got to be a dancer, so that's one of my exercise. And one of my exercise, that's why I'm so good at the age of 72, is I do a lot of walking. I do not get transportation, I do a lot of walking. I was worried about then because my friends always invite me to a party to go and dance. Because I got some friends who love to see me dance. So when it started to swell, I couldn't wear sandal, I couldn't wear a shoe. I couldn't even go to church.
So once they come here, they get that care that is required. If they have an ulcer, if they have whatever entry lesion that they have, that is treated here.
When they used to share these tablets, I used to disregard them. And when I know the importance of the tablet, when I got this foot, then when they come around again and give me tablets, I throw down my throat in front of them and say, when I go inside and drink some water. So it's very good.
These patients are listening to us when it comes to taking care of themselves, taking care of the affected extremity. They're listening to us when it comes to following the treatment regimen for lymphatic filariasis. Most of the patients with lymphatic filaria, the stigma that's attached to them, it's something that's overwhelming.
Yeah, these times your name changed. You're no longer who you are, a Bigfoot lady. A Bigfoot woman. You have some neighbors. As soon as you put your face to the door, you're Bigfoot so and so. That is how you face the life every day.
recognizing that so many persons have been afflicted, recognizing the loss of years of production and their ability to contribute to society, and then their personal losses. I think when you put that all together, we recognize that it's worth investing in upfront and prevention, and therefore the ministry has decided it's worth the investment, and we have fully embraced the strategy for elimination.
The program has two main components. One is what we call the Mass Drug Administration, or MDA, and the other component, the second component, is the management of the chronic morbidity caused by lymphatic filariasis, especially lymphedema, and hydrocele lymphedema is also what people popularly call elephantiasis, or here in Guyana, Bigfoot.
The decades of lymphatic filariasis, the cost to society, the cost of drugs, the cost of the stigma, the human suffering is going to be cut down. And that, for me, it's priceless.
That would be good. I have 6 children, I have 12 grandchildren, I have great-grand. And that would be very, very good. Because as I say, I wouldn't like to see a dog go through this.
Since I started with the shoebox, I still dance. My friends still give me a call.
Welcome back to the program. For those of you who have just tuned in, today we're talking about the Filaria campaign here in Guyana. Dr. Sampson, for pregnant women and persons who are ill, can those persons take the Filaria pills as well?
So we have persons who are absolutely excluded from taking the pills. They fall within our exclusion criteria. So the first category is your pregnant women, those persons who are seriously ill, and those persons who are less than 2 years old. They cannot participate in the campaign.
Okay. For persons who are a bit hesitant about taking the pills, what would be your encouragement to them?
Please don't be. Mosquitoes are not hesitant when they want to take a blood meal. They just go right ahead and bite you. They're not concerned. So if they're not hesitant and they're the ones that's spreading the disease, you should not be hesitant about protecting yourself and preventing a disease that is long suffering, that causes a lot of social stigma, and that even cause a lot of financial difficulties for persons. They're unable to work as they would want to. You might be looking at yourself and telling yourself you're perfectly fine, but you don't know, because I mentioned earlier the 2021 survey that we did, where we found persons who were actively transmitting the disease within their communities. And you might be surprised that they had nothing, they were perfectly fine. They had none of the clinical manifestations of the disease, and they were the ones who had the parasite actively transmitting the disease within their community. So you don't know. So the best thing for you to do is to take your Filaria pills to prevent you from having the disease.
Indeed. How long does this disease take to develop? You mentioned that there are persons who don't even know that they have that. How long does it take to develop?
So you can be infected now, and the manifestation takes 10 to 15 years before you can actually see or know, without you doing a test, to know that you have Filaria.
What treatment is available for persons who have Filaria, and it probably would have blossomed over the years?
So in the early stages, it's curable. That means when you now have it, there's no, for example, for those persons who we found in the survey that had no clinical manifestation whatsoever, and we know they had the parasite, they were treated with albendazole, the DEC, and also doxycycline. That's the treatment regimen that we use for persons or patients who are positive by microscopy for the disease. For those patients who have the chronic manifestation, that is swelling to the arms, the leg, the breast, or the scrotum, and they're not actively transmitting, meaning that they just have the manifestation, but they have no parasite within their bloodstream, we do what we call cares treatment for them. They are not necessarily dependent or need medication because, of course, they have no worms for us to get rid of. So they don't need to be dependent on the medication. They have a different type of treatment or care that we would give to them.
How can family members support this process or better care for their loved ones who have this disease?
That's a very important question because it's not easy on patients. And, you know, persons would tend to think that it's not a disease, that they don't see people around the place with it. But let me tell you, I've dealt with these patients and they mask it very well because of the stigma and discrimination that's attached to it. So I would encourage family members to be there, be supportive of them. It's difficult for many of them to come to clinic on their own because, you know, public transportation is difficult for them to hop in and out of a bus because the leg is so swollen, it's so large, you know, they can't fit it through a seat and so on. So my encouragement to family members is be supportive, be helpful, you know, encourage them also. It's not easy living with a disease like that. Up to a few weeks ago, I received a call from a patient because we do have that relationship. She was in a lymphatic filaria crisis where she had the swelling to the leg was, you know, she had what we call an acute attack, So that is where you may have a cut, scrape, or bruise to the extremity and it introduces bacteria into the bloodstream and the patient has fever. It's very painful. They're unable to walk and so on. And you know, she called me in so much pain and she was crying and her daughter was there with her and that was good to see that family member was there helping her along. Doc, what can I do? What do you think I should do? Can I come collect the medication for her? So that's the kind of relationship we want family members to have with these persons. Be supportive. The support and the love and the care and attention that you give to them goes a very long way.
Indeed. You spoke about the family and their loved ones, but what about the community at large? What can the community do to ensure that, you know, we support those who are dealing with this disease? I know stigma is a big deal, and we hope that, you know, the stigma when it comes to filaria can end. So what can persons in various communities do to support those who are, you know, taking medication, those who are going through this illness?
We have a culture in Guyana whereby you're called or you have a false name based on something physically that might happen to you or a sickness that persons may know that you have, and that's the name you have in the community. So I would want to encourage community members, residents, not to do it. Imagine it's your family. Would you like someone to go around saying, oh, he got big foot, she got a big hand, or, you know, the man, oh, goatee man, or whatever the case may be. Don't do it. Be supportive and encouraging also. They need your help. If you see them going down the road and they're carrying something that's too heavy for them, just assist them and let's stop the name calling and educate ourselves about the disease so that we can better understand how to approach and deal with these individuals, because it could be your family member and we wouldn't want anybody treating our families like that. So of course, be supportive of them also, loving, caring, kind to them when you see them.
Indeed. Dr. Sampson, before we wrap up today's program, with regards to our pill distributors, those persons will be visiting homes in various communities across regions 3 as well as 4, right?
Yeah.
If someone probably would have missed that visit, how can they get their pills?
So if you missed us, you can visit any of your health center across regions 4, East Bank, East Coast, and in Georgetown. And for region 3, you can visit the Parfait Harmony Health Center to get your pills. And also, you can stop by at Vector Control Services. That is located in the GPHC compound using the Middle Street entrance to get your pills.
Thank you, Dr. Sampson. I want to say thank you to you and your team for the great work that you guys have been doing. Keep it up.
Thank you so much. We really appreciate you, and thank you for having us so that we can, you know, spread awareness about the campaign.
Go spread the word in your area. We gonna end filaria. Prevention is the only cure.
I'm Dr. Kim Dixon, the head of PAHO, I just took my pills. Last year, I was all the way in the Pacific, in Samoa. They did a campaign there. I took the pills there. This year, I'm in Guyana. The campaign is on. I've taken my pills. Regardless of where in the world I am, once they are doing the campaign, I'll take my pills. I encourage you all to take your pills too. Thank you.
What we are talking about,